These are the 17 most bizarre diseases. From the strangest to the deadliest, living with AIWS can significantly impact daily life. The frequent and unpredictable nature of these perceptual distortions can make it challenging to perform routine activities. For example, someone might struggle to navigate through their environment, as objects may seem far away or closer than they actually are, or may appear to change size suddenly. These experiences can be particularly distressing for children, who are often the most affected by AIWS. In Capgras syndrome, the affected individual's recognition of familiar faces is impaired. While they can correctly identify the physical appearance of a person, they experience a disconnect in the emotional recognition, leading them to believe that the person is an imposter. This delusion can extend beyond people to objects, such as believing that a pet or a home has been replaced with an identical duplicate. The impact of Cotard syndrome on a patient's life is devastating. The delusional belief that they are dead or missing certain body parts can lead to severe depression. Patients may isolate themselves from family and friends. In extreme cases, the delusion can drive individuals to suicidal behavior, as they may feel that there is no purpose in continuing to live. FDIA is a serious mental health condition in which a caregiver, usually a parent, fabricates, exaggerates, or induces medical symptoms in someone under their care, typically a child. This can include adding blood to urine samples, withholding food to induce weight loss, and administering medications to produce symptoms. This behavior is driven by a psychological need to assume the sick role by proxy, gaining attention and sympathy from medical professionals and others. Pica is an eating disorder characterized by the persistent consumption of non-nutritive substances for a period of at least 1 month. These substances can include items such as dirt, clay, chalk, soap, paper, hair, paint chips, metal, or ice. The disorder can occur in individuals of any age but is most commonly observed in children, pregnant women, and individuals with developmental disabilities. Proteus syndrome is an extremely rare genetic disorder characterized by abnormal and excessive growth of various tissues, including bones, skin, and other connective tissues. Named after the Greek god Proteus, who could change his shape at will, this syndrome manifests with highly variable and asymmetric overgrowth patterns, which typically begins in infancy or early childhood and continues throughout life. In Rapunzel syndrome, individuals compulsively pull out their hair and ingest it, leading to the accumulation of a large hairball in the gastrointestinal tract. The hairball can cause a variety of symptoms, including abdominal pain, nausea, vomiting, constipation, weight loss, and even bowel obstruction or perforation in severe cases. The presence of the hairball can also interfere with the absorption of nutrients from food, leading to malnutrition and other related health complications. Individuals with Harlequin syndrome are born with thick, armor-like plates of skin covering their bodies, giving them a distinctive appearance reminiscent of the diamond-patterned costume worn by the traditional theatrical character Harlequin. The impaired skin barrier function increases the risk of dehydration, infection, and heat loss, making affected infants particularly vulnerable to life-threatening complications in the neonatal period. Individuals with Angelman syndrome typically exhibit a happy demeanor, with frequent smiling, laughter, and excitability, which led to the colloquial term cat grab syndrome, due to the appearance of laughing or grinning like a cat. Dandy Walker syndrome is a congenital brain malformation characterized by abnormalities in the development of the cerebellum, which is the part of the brain that coordinates movement and balance. This syndrome typically involves the formation of a cystic structure in the back of the brain, known as the posterior fossa cyst, as well as abnormalities in the fourth ventricle, a fluid-filled cavity within the brain. Fish odor syndrome is a metabolic disorder characterized by a strong and offensive body odor that resembles the smell of rotting fish. This distinct odor is caused by the body's inability to properly metabolize trimethylamine, TMA, a compound found in certain foods rich in choline, such as fish, eggs, and legumes. In Dahl syndrome, affected individuals may exhibit a distorted perception of their own body image, often believing that they possess delicate features, flawless skin, and a fragile, doll-like appearance. They may engage in behaviors aimed at achieving or maintaining this perceived ideal, such as excessive grooming, cosmetic procedures, or restrictive eating habits. Some individuals may also adopt mannerisms or behaviors they associate with dolls, such as speaking softly, moving gracefully, or avoiding physical activity to preserve their perceived fragility. Moebius syndrome is a rare neurological disorder characterized by congenital facial and abducens paralysis. This condition typically presents with a lack of facial expression due to the inability to move the facial muscles, including the inability to smile or frown. Additionally, individuals with Mobius syndrome often have limited lateral eye movement, which affects their ability to move their eyes from side to side. Perry-Romberg syndrome is a rare disorder characterized by progressive wasting away of the tissues on one side of the face. The primary feature is the progressive loss of subcutaneous fat, muscle tissue, and skin on one side of the face, leading to sunken appearance, soft tissue shrinkage, and skeletal changes. These changes may affect various structures of the face, including the skin, muscles, bones, and cartilage, resulting in facial asymmetry, drooping of the mouth or eyelid, and dental abnormalities. Brugada syndrome is a rare genetic disorder that affects the electrical activity of the heart, increasing the risk of abnormal heart rhythms and sudden cardiac arrest. Individuals with Brugada syndrome may experience episodes of rapid, irregular heartbeats, known as ventricular arrhythmias, which can lead to fainting, seizures, or sudden cardiac arrest. Hypertrichosis is a medical condition characterized by excessive hair growth on areas of the body where terminal hair does not normally grow. This abnormal hair growth can occur anywhere on the body, including the face, arms, legs, back, and chest. Hypertrichosis can be present at birth or develop later in life, and it can affect both men and women of all ages and ethnicities. Progeria is a rare genetic disorder characterized by accelerated aging in children. Affected individuals typically appear much older than their chronological age, with a characteristic facial appearance marked by a disproportionately large head, prominent eyes, thin lips, and a small chin. They may also experience symptoms commonly associated with aging, such as atherosclerosis, cardiovascular disease, and osteoporosis. And there you have it, folks. Thanks for joining us on this journey, and until next time, stay curious and keep learning.